Hi everyone, it's me, Melanie, your IVF nurse. This week's topic is going to be about infectious disease screening. Now, most of you may wonder why this has to be done. The importance behind it is that you want to make sure that there is nothing that you should be aware of that maybe you haven't had tested in the past. It's important for the clinic to know, depending on if they're dealing with gametes, so sperm and eggs, if there's anything that can contaminate the lab. You want to ensure when you're trying to get pregnant that you are also healthy and that the doctor or the clinic is doing their due diligence to ensure that you're going to have a healthy and safe pregnancy. Now, at your initial consultation with your reproductive endocrinologist or your first visit to the fertility clinic, they are going to provide you with requisitions. They may do this on site or they may have you do it off site. And this is for the general screening, so your infectious disease screening. So things like HIV, HTLV, hepatitis A, B, C, CMV. They'll have you do also a complete blood count, which is just a CBC, which gives information about your group and screen, as well as hemoglobin, and if there are any issues with, say, sickle cell or beta thalassemia, alpha thalassemia, those types of things. Now, every clinic does have their policy in terms of how frequently this needs to be done. So for those that are being informed by your clinic that it's every 6 months, then you do want to make sure that it is done every 6 months. Usually the nurses will inform you when it needs to be repeated. Most clinics, however, across the board will at least have them done annually. And this is anytime you're doing, say, an insemination cycle, timed intercourse cycle, if you're doing an IVF cycle, you're having those done at least annually through your clinic. And then what you also need to consider is that everyone involved needs to have the screening done as well. So if you are in a same-sex relationship, both of you need to be tested, only because there is that exchange of bodily fluids, and it is, according to Health Canada, that everybody be tested. The other thing is that when you're planning for frozen embryo transfer, a lot of the times there is a big issue about, well, you're using frozen embryos, you're not creating anything, why does my partner need to be tested? Same thing happens, is that through the eyes of Health Canada, you are looked at as though your partner is your sexual partner, regardless of if you're having sex or not. The embryos that were created and may be in storage, what they want to do is check for any type of seroconversion. So if anything has happened in the time since the embryos were created, the lab needs to be aware of that, as well as your own physician needs to be aware of that if there's any changes in your health recently. Your partner, whether it's a heterosexual relationship, same-sex relationship, your partner needs to be screened as well. As mentioned before, in the eyes of Health Canada, your partner listed is your partner who you are sexually active with, regardless of how much sex you're having. So you do want to make sure that your screening is up to date, because this, if it's not up to date, can cause delays in your cycle. So anytime you're reporting your day one or anytime you're about to start a cycle, you want to at least check with the nurses to make sure that everything is completed. You don't want to get stuck mid-cycle or just before transfer or just before egg retrieval being told that you have to be poked, or that there's going to be a delay in your procedure. www.yourivfnurse.com. You can feel free to email me at yourivfnurse@gmail.com. Have a great day.